part of the Level 1 certificate in Introduction to Health, Social Care and Children and Young People's Settings, run by Plato Training, and this is Unit 6, Introductory Awareness of Health and Safety in Health, Social Care and Children and Young People's Settings. By the end of the session, you will know the main responsibilities of workers and employers for health and safety in health, social care and children and young people's settings. You will have an understanding of the importance of assessing risks in relation to health and safety. You will understand the importance of key areas of health and safety in relation to health, social care and children and young people's settings. You will know what contributes to the reduction of the spread of infection in health, social care and children and young people's settings. As always, you need to look out for the green box which tells you which question the slide relates to, and that will support you within your answers. And remember that the PowerPoint presentation here to guide with pointers, and doing your own research and sharing your own ideas demonstrates a much stronger understanding of the content of the session. So we're going to start the session by looking at key areas of health and safety, and you will see this slide relates to question number 1. And we have a list here of key areas. I'm just going to talk you through the list, and then I want you to think for a few minutes before you move to the next slide what you think each of these key areas may involve. So we've got fire safety, we've got moving and handling, first aid, security, storage and disposal of hazardous substances, storage and administration of medication, and infection prevention and control. So for a few minutes, think about those, and just think, what actually might be involved, or what does it mean? So you will see fire safety. So that's about having the correct firefighting equipment, keeping fire escape routes clearly marked and making sure that they're not obstructed at all times. If somebody needs to escape out of the fire exit, it needs to be free from anything in front of it, so that, in an emergency, people are able to get out. Moving and handling. So this involves lifting equipment safely. It could be you're lifting a person, a child, an adult. So you need to make sure you do that in a safe manner, using the equipment for lifting. So if you've got equipment available, this comes under the moving and handling, making sure you use the equipment. And also we'll look a little bit further on within this session, but making sure you're trained to use the equipment correctly as well. First aid, so ensuring you have a first aid certificate, a relevant up-to-date first aid certificate, which obviously involves doing first aid training courses to get the certificate. Security, which includes data protection, which is also GDPR, risk assessment, and that's both indoors and outdoors. And again, we'll look at these further on throughout the session for you to have some more understanding about those. Locked doors, locked gates, these all come under the risk assessment, making sure the area is as safe as it possibly can be. Storage and disposal of hazardous substances, so this includes cleaning equipment, so like all your cleaning, your sprays that you clean equipment with, bodily fluids and nappies. Storage administration of medication, so ensuring you have permission to actually to keep hold and provide the medication. It would need to be in a locked cupboard. You would need a witness to say that you've given medication, signed records also to say you've given it, and also the medication usually needs to be prescribed if you're going to be administering medication. And finally, infection prevention and control, which includes hand washing, exclusion periods. So if somebody has an infection or a contagious infection, For example, say chicken pox, exclusion periods need to be in place. You need to record and report any notifiable diseases. So this brings us to question number 1, and it's asking you to outline four key areas of health and safety related to a work setting. Remember to use a sentence for each example. And for example, think about what you will need to use to safely lift or move an object. So think about the slides that we looked at before. So for example, with that one, we talked about having the appropriate equipment if you are to lift safely. So think about the last two slides and also think about, doing some research of your own, but you need to outline 4 key areas of health and safety related to a work setting. So this slide relates to question number 2, and you will see it's a piece of legislation, and it is by the Health and Safety Executive, and it's the Health and Safety Law and what you need to know. Now, you might not be able to see this very clearly on this slide, on this video. So what I would suggest is maybe do some research, do a Google, and find this piece of legislation to help you to read it a little bit clearer. But what it's saying, you'll see this up in most employment buildings. As I say, it is law, so it needs to be on the wall. It could be on the entrance when you walk into a building. I've seen them in staff rooms, and it's telling you what employers must do for you, what you must do, and also if there's a problem. There's a website there. You'll see the www.gov.uk website there, HSC.gov UK website. And again, you have a look on that website to see this a little bit clearer and have a read of it. And that obviously will help you with question number 2. So here on this slide, we have some employers' responsibilities for health and safety. So employers must have a written procedure which contains rules about how to work safely. Employers must check the rules regularly to make sure that they support a safe working environment. And employers must provide equipment and training needed to keep everyone safe. So like I said earlier on when we were talking about lifting and using a piece of equipment to lift an individual or a piece of equipment, employers must provide training and that equipment to ensure that you do that in a safe manner. They need to keep up to date with their written procedures because things change on a regular basis. So it's important that the employer is responsible for making sure those procedures are kept up to date and making sure they do that on a regular basis. So question number 2 is asking you to outline 3 employers' responsibilities for health and safety. Ensure you use sentences for each of your examples and also think about what your employer should be providing you regarding to the answers in question number 1. So what should they give you so you know how to lift, like I said before, how to lift and move objects correctly. So as I said before, you have a look on the government website also, looking at the health and safety regulations to help you within to support the answer for question number 2. So we're now going to look at this slide which relates to question number 3. And this is looking at the workers' responsibilities. So the employees, they're the workers. We've looked at the employers' responsibilities on the last question and the last slides. We're now going to look at the employees. So we said previously that the employers have a responsibility for putting procedures in place for safe working practice, and it's up to the employees to follow those procedures to make sure they keep themselves safe and others safe. And this employees must always use protective equipment available in the work setting. So this could be wearing gloves and aprons, so your PPE, your personal protective equipment, and like we said before, using the the lifting equipment. If you were lifting somebody, you know, that's there to protect. So you make sure you know, you need to use it. It's there, and you need to use it and know how to use it also. And also, employees must tell someone if they feel that you know, another worker is not following the you know, the precautions, and they may be putting somebody else as health and safety at risk. So if they, you know, if you saw somebody who wasn't using a piece of lifting equipment to lift a service user, so they may an adult, then obviously they're putting themselves at risk and the service user at risk by not following the procedures in place to lift that person. So question number 3 is asking you to outline 2 employees' responsibilities for health and safety. So ensure you use sentences for each example, and you'll see there, you know, like the last one before, last question, have a look back at question 1 and 2 and just have a look, you know, what if your employer has a responsibility providing you with something, you know, what do you need to do to ensure the workplace is safe? So we're now going to look at this slide, which relates to question number 4, and we're going to look at health and safety training. Now, we mentioned a little bit about first aid training earlier on at the start of the session, but it's really important. You will get first aid training when you're working in the care environment. Now, it varies from how many first aiders you will need in a setting. However, in childcare, it's called paediatric first aid, and usually they have every member of staff will need to be paediatric first aid trained in a childcare environment. Now, once you start within your within a health and social care setting, you know, you will be sent on a first aid training course. You will get a certificate, and they usually more often than not, they last for 3 years, and then they need to be updated. And again, it's up to your employer to keep that to make sure that you're up to date with your training, and also yourself. So, you know, if you feel like your certificate is coming to the end of its of the period, then obviously, you know, you need to make it clear to your manager, to the employer, that it needs updating. Food handling. So within the care environment, you'll be handling food with adults and children, and again, that will be some training course that you will most probably attend to get a food handling certificate. Fire safety, really important that you know about fire safety, and some of these training sessions will be internal training sessions, so it may be on your induction when you start at your new setting, where you know, you will talk through some of these things. So fire safety will be something that you need to know about, you know, what the procedures are in place for if you spot a fire, or you know, and you raise the alarm, or if you hear the fire alarm, and knowing what the fire alarm is, because sometimes it's a bell, it can be a whistle, you know, it depends on the individual setting. So it's important that you know that, and what your responsibility is in to get yourself and anybody else out of the building safely. Hand washing, again, hand washing is a really big thing currently with COVID-19. You know, as it was before, it's important that you do, you know, you have to keep your hands washed, dried, clean, and knowing how to do that correctly. Moving and handling, we've talked quite a bit about that over the last few slides, but that's about lifting equipment, children, adults, making sure you know how to do that in a safe manner to protect yourself. The storage and administration of medication, again, you need to know what the procedures are for that within your settings. You know, most of these procedures, as I said before, they're very similar, but they may just be different ways that each setting might do it. Disposal of bodily fluids, so that could be, you know, with children it could be nappies, with older adults or young adults, it can be, you know, the bodily fluids, how you dispose of that. Use of health and safety equipment, so knowing how to use that as well. All these things are a part of the health and safety training that you will receive within the health and social care settings. So this brings you to question number 4, and you need to give 4 examples of health and safety training required in the work setting. So think about the last slide and what we've talked about, but also you can give your own ideas, do your own research. You need to give 4 examples, and you need to write a little bit about each one that you give, and why you might need training in that particular area. So we're going to now look through the next few slides, looking at hazards and risks. So the first slide here relates to question number 5, and it's just a slide to talk about hazards versus risk. So a hazard is anything that may cause harm, such as chemicals, electricity, working from ladders, an open drawer, etc. The risk is the damage the hazard can cause. So it is the chance, high or low, that someone or somebody could be harmed by these and other hazards, together with an indication of how serious the harm could be. So, for example, a hazard could be a wet floor, and the risk is that somebody could slip on that wet floor. And here's another example. So a risk is what can happen as a result of a hazard. So for example, a tray of cups left on the stairs in a care home can cause someone to trip over the tray and fall on the stairs. So question number 5 is asking you to outline what is meant by risk. So think about what we've just talked about on the previous slides and outline what is meant by risk. So on this slide here, it relates to question number 6, and there's 2 links to 2 YouTube clips. There's a childcare example and a health and social care example, looking at hazards and the risks. So you probably would need to copy and paste them into your internet search engine. Watch them both, have a think. You can make some notes. You can some of the pointers that you come across within these 2 videos. So this slide again relates to question number 6, and there's some examples of risks and hazards. So the hazard is a soiled nappy in a bin, and the risk, if that bin is left open, young children might put their hand into the bin and develop an infection. Another example, so the hazard is the door to the setting. The risk, if it's left unlocked, children and vulnerable adults may go out alone. The chemical storage cupboard, so the risk, if this is not locked, there is a chance a child or vulnerable adult may access the cupboard. And obviously if it's got chemicals in there, they could get hold of the chemicals. And another hazard, so trailing wires and cables, and the risk, so this is a tripping hazard, so everyone in the setting, it's a risk to everyone. Somebody could trip over it. So question number 6, you need to give 4 examples of hazards in health and social care or children and young people settings, and also their associated risks. So identify the hazard and then write what the risk of each hazard is. Think about the videos that you've watched and also some of the examples on the slides, and I'm sure you can think of some more examples yourself, looking at the risks and hazards and risks. So we've talked about risks, hazards, risks, but now we're going to look at risk assessment and what the purpose of a risk assessment is. So risk assessment is about identifying the risk. So we've identified a few risks in the last question. You've looked at a wet floor, you've looked at an unlocked door, you saw the videos. So we want to know, why we need to identify the risk so that we can potentially, stop anybody getting hurt. So it's important that we do a risk assessment. So assessing the risk, so this is by specifically focusing on the age and abilities of the individual. So if you were in a nursery environment and you were working in the baby room, it's important that you think about the risks, thinking about the age and of the babies. Once babies start crawling, they start investigating, so you need to put safety gates up, making sure that there's no trailing wires where a child could pull and then they could pull something on top of them. So it's important that you focus on the age and ability of those individuals that are going to be in that room, in that setting, or you're going to be working with. You need to identify who may be harmed, and then you also need to identify how you can minimize the risk. Okay. And this slide, it just reiterates really what's just been said. So the purpose of a risk assessment is to identify a risk, assess the risk by, specifically focusing on the age and ability of the individual, identify who may be harmed, and then identify ways of minimizing the risk. And this leads you to question number 7, and you're going to outline the purpose of a risk assessment. Make sure you use sentences, develop a small paragraph to outline the answer. And a tip here, say what a risk assessment is, then say why it is used. So we're going to look at the slides that relate to question number 8 now. So when is a risk assessment necessary? So I did talk a little bit earlier about in a childcare environment, in a baby room. So in this slide, for example, indoor and outdoor environment, using the equipment on trips out, and food preparation. So it is really important that you think about all areas that you're going to be working, like it says, indoors, outdoors, especially, well, in a nursery, in a childcare environment, children spend a lot of time outside, sometimes as much as they do inside. Sometimes they have an open door policy where children, as long as there's an adult member of staff with them, they can go out and play inside and outdoors. Trips out, again, in a childcare environment, you may have some trips out to the local park, etc. And also when you're working with adults, you may go out in a car, on the bus, the train, you may walk to the local shops, the park. So it's really important that risk assessments are done, and also with food preparation, risk assessments. So looking at certain, what if anybody's got any allergies, if the size of the food that you're serving. Another example of this could be if you're working with young children and you're serving, for example, grapes. Children can, there's been known to choke on a grape, so it's about knowing how you cook grapes safely so that the children can eat them. So a risk assessment should be carried out and checked regularly to make sure that a work setting is safe for everyone. A risk assessment is necessary when a child or adult have different needs, such as they may be a wheelchair user. Another time is when new equipment is bought into the work setting and when new staff join the setting. Another important time is if there have been an accident that has happened in the work setting. So again, if an accident has happened, a risk assessment needs to be done to find out why that accident happened. Accidents do happen, but as long as we can, assess the situation and prevent something happening, if something does happen, then obviously we will look at it again. But hopefully it would be something minor, and you've assessed the situation as best you can. So this brings you to question number 8, which is asking you to identify at least 3 occasions when a risk assessment is necessary. It's an identify, so you need to give a supporting sentences to explain, and at least 3. So you can do more, but not less than 3. So I'm going to talk you through 2 scenarios now. They're not in your workbook, so they're just to get you thinking really. It's relating to question number 9. So the first scenario, you are the key person for 3-year-old Jack. Jack is usually collected by his mother or father at the end of the day. You are told by a colleague that his Uncle Andrew has come to collect him. You've not met Jack's uncle before, and when he was dropped off this morning, Mum did not say that anybody else would be collecting him. So what would you do? How can you protect yourself and Jack in this situation, and why do you need to protect yourself and Jack? So think about those last few questions for a moment, okay? You're in that situation, you're the key person for Jack, and his uncle has you've been told his uncle is going to come and collect him, what would you do? You know, you need to think about how you protect yourself and Jack, and also why do you need to protect yourself and Jack. So have a think about that for a few minutes before you move to the next slide. Okay, so there's some feedback here. So when you're working with children and in a childcare environment, you will have when the child starts with you, you know, you will have a list of people who are authorised to collect children. Okay, now you've got that in writing, or it's usually by the parents who will give you that information. And if there was somebody else come to collect that child, you usually will be told in the morning, let's say, when the child is dropped off. However, you know, certain things do happen throughout. They might be, you know, the parent might have to work late, they might have an appointment, and, you know, they would let you know that somebody else is coming on that list, will be collecting them. But what you need to do, because obviously with this situation, you've not been told and is not on the list. So you need to check if there are any telephone messages first of all, and check if he is on the list. Is there a password that can be asked? Because again, parents would give you a password that only you and they know, so that you know that it's really, you know, them that are going to be telling you that someone else is coming. You could telephone Jack's mother or father to check that this is okay. But if you are in any doubt, do not send the child with this person. You know, you can feel quite pressurized sometimes if somebody's coming and telling you that you know, the child's uncle. The child might see them and they know them, but you really do have to have permission. If you've not got the permission, if that child's uncle is not on the list, you know, it's important that you don't send that child, because you need to protect that child for safety. You need to protect yourself. You're putting yourself in a position, you know, if anything happens to that child, you know, even if it is the child's uncle, the parents might not be speaking to the child's uncle, they might have had a fallout, you know, you really just don't know. So you just make sure you follow the procedures that are in place and check all avenues, and if in any doubt, don't let the child go with that person. So the second scenario, so you're working in a care home for people with dementia. A maintenance man has arrived to fix the ceiling after a leak a few weeks ago, and you weren't expecting him today. What danger could happen to yourself as a staff member? What danger could happen to the service users? And what can you do to ensure he is meant to be here today? So again, have a few moments to think about, you know, the situation, and think about the questions there, and how you might answer those. And think about those before you move on. So here's some feedback. So if you don't follow your procedures, you will be liable for any of the consequences if anything happens to the service users in your care. The same with the situation before. If you let that child go, you know, you will be responsible for those consequences of what might happen. The person that you're letting in to the care home might hurt you or the service user if he's not who he says he is. Ask a member of the team, the manager, a team leader, or your colleagues to see if they have organised a visit. Check identification of the person to make sure they've got ID on them, and telephone the company he works for to check he is who he says he is. So there's some of the things that you can put in place, but remembering, like the one before as well, you know, if in any doubt, you don't let that person in, or you don't let that person go, like we said before, because you could be putting other people at risk, and also you will be liable for any of the consequences if you do. So remember, sending a child home with someone who is not authorised to do so may put a child at risk of harm. Remember, you are responsible to follow procedures in place, and if you don't, you will be liable and in breach of your own contract of employment. Signing in procedures are in place in all childcare settings. If you do not follow this procedure and ask all parents and visitors to sign in, you'll be liable and in breach of your contract. If there was an evacuation due to a fire or another incident, you will need to know that everyone is out of the building safely and accounted for. So that brings you to question number 9, and you need to outline the importance of protecting your own security and the security of others in the work setting. So think about the last 2 examples and some of the comments that we made, and outline why it's important that you protect your own security and the security of others in the work setting. So we're now going to look at slides relating to question number 10. And it's about the importance of protecting your own security and the security of others in the work setting. Now think about these. So security is important in the workplace for myself and others because if there is an accident and the workers do not follow the procedures correctly, they may be held responsible and they will be breaking the law and may lose their job. Security is important in the workplace for myself and others because someone may get seriously hurt or even die as a result of not following correct procedures. So this brings us to question number 10. So think about the last 2 statements that we talked about, but also do some research and think about some others. And then you're going to outline 2 reasons why security is important in the workplace for yourself and for others, and show what consequences could happen if security is not in place. So we're now going to look at the slides relating to question number 11, and it is something we've talked about over a few of the slides already, but it's about safe moving and handling principles. And you'll see on this slide here, it says before attempting to move someone, you need to ask yourself, do they need help to move? Do they require help or supervision? Have you told them you're moving them? How heavy are they? Are you healthy and strong enough to move them? Is there anyone who could help you? How long will it take? Is there enough space around me? Are there any obstacles in the way? And are you wearing suitable clothing and shoes, for example, if you're on a slippy or damp surface? So these questions are really important. You need to ask yourself these questions. And, especially the very first one, the first 2, do they need help and do they require help or supervision? Because we taught and you've looked at person-centered care and supporting independence, and actually they might not need help. They might be able to just need a little bit of help. They might be able to do more than so that is really important, but as are all the other questions as well. So there are 2 short clips here on this slide, one for childcare and one for health and social care, and the short videos looking at safe moving and handling. So again, you might have to copy and paste the links into your internet search engine. So have a look at those before you move on to the next slide. So the importance of safe moving and handling, and now you've watched the videos, I'm sure you'll have some more ideas on those. When working in health, social care and children and young people settings, people and equipment must be moved safely so that no one is injured. So for example, care workers may need to help older age adults get out of bed or help them to get out of the bath. Training is important, as we've talked about previously, to be able to do this, and if not followed, may injure your back or injure the service user. When working in health, social care and children and young people settings, people and equipment must be moved safely so that no one is injured. So for example, the nursery workers will need training to safely lift babies and young children out of a high chair. If this training is not followed, you could injure your back and the children that they're lifting. So for question number 11, you need to outline the importance of safe moving and handling practices. So think about the slides, think about the videos, and then outline the importance of it. Okay, so we're now going to look at accidents that may occur in health, social care, children or young people setting, and it relates to question number 12. And you'll see here some of the accidents that may occur: bumps to the head, choking, trips and falls, vomiting, nosebleeds, cuts, grazers, fractures, burns, unconsciousness. So there are some. You can think of any more, it would just relate to question 12, so you should be able to think of some more as well. This also relates to question number 12, and it looks at sudden illnesses that may occur in a health, social care, children or young people setting. And you'll see if there's rashes, breathing difficulties, allergic reactions, stroke, heart attack. And again, think of, if you can think of any more, obviously you can use those for the question number 12. And question number 12 is to identify 4 accidents and 4 sudden illnesses that may occur in a health, social care, children's or young people's setting. So you're now going to look at question number 13, and we're looking at this slide, who might deal with accidents and sudden illnesses. So the people who might deal with accidents and sudden illnesses will be the appointed first aider, or if everyone is first aid trained, the one that is nearest to the incident. So that means that, like I said earlier, usually in a childcare environment, everybody will be first aid trained, paediatric first aid trained, but it's important that you know who is first aid trained, and it's also important that you know who is a designated first aider, because in some settings you will need to go to the specific designated first aider, but it's really important that you know who deals with that, because for example, so if a child falls over and they graze the knee, if you're not first aid trained, you're going to help that child up, as long as that they're not unconscious or they've got a serious break, or you can usually pick a child up, a toddler up, toddlers fall a lot, graze the knee, give them some comfort, and then you'd obviously get a first aider to clean the wound and put a plaster on it. However, if it was a more serious accident, or somebody had taken really poorly, you need to get the appropriate person. The procedures are there, they're in place, you need to know what those procedures are, and you deal with that in the appropriate manner. It could be like, if it was a serious accident and somebody was unconscious, an ambulance might need to be called. So again, you need to know what that procedure is so that you can deal with it. And that brings us to question number 13, to identify who might deal with accidents and sudden illnesses in the work setting. So this slide now relates to question number 14 and question number 15, and it gives you some idea on how infection is spread and also some of the methods to reduce the risk of infection. So there are many ways that infection is spread. So these are by not following hand washing procedures, not following disposal of bodily fluid procedures, by sharing towels and sharing feeding equipment. Another way is not by cleaning the toys properly and having unclean surfaces. If a person or a child attends a setting when they're unwell, or if they have an infection, that's another way of spreading infection amongst each other. The best way to reduce the spread of infection is to make sure there is a high standard of cleanliness and everyone in the setting follows all the health and safety procedures that are in place to make sure the cleanliness is there. Young children and some adults will need to be supported to carry out some procedures properly. So for example, hand washing or toileting, it's really important you remind a child to make sure that they do wash their hands when they've been to the bathroom, when they've been to the toilet, and also show them how to wash their hands properly as well. It's also important that we talked before about infection spreading if a child attends when they're unwell, so exclusion periods need to be in place, so that way the infection, you try and reduce the risk of it spreading to others if that child or that young adult is excluded for that short time while they have that infection. So question number 14, you need to describe how infection is spread, and in your answer you need to use at least 4 examples of how it spreads, and also it's a description, describing answer, so you make sure you write in sentences. And question number 15 is asking you to identify at least 4 methods that reduce the spread of infection. It's an identify question, so you need to just write one short sentence just to back up what that method is. and how it can reduce the spread of infection. So this slide relates to question number 16, and we talked a little on the last slide about showing children how to wash hands correctly, and that's for adults also, members of staff, service users. It's really important that you do know the technique and always using soap and water. And this slide has got some 13 steps there which will help you when you're looking at question number 16. And question number 16 is asking you to describe the standard method of washing hands. So we're now going to look at the slides relating to question number 17, and we're going to look at personal protective equipment, which is often known as PPE. But what is it? So here are some examples of what it is. Again, do some of your own research, but it includes aprons, gowns, eye protection, masks and gloves. So we're now going to look at a slide relating to question number 17, and we're going to look at personal protective equipment, which is often known as PPE. So I'm going to talk a little bit about what it is and then when it should be used. So personal protective equipment, it could be aprons, gowns, eye protection, masks, gloves. And here you'll see some examples of when it will need to be used. So food handling. So handling any food, preparing and handling food, your gloves, your aprons, appropriate plasters if you've got cuts on hands. Some of you may have seen, but when you're working in food hygiene, and blue plasters are usually the norm. So that obviously they're bright, and if it did fall into part of the food you're preparing, you'd be able to see the plaster. Personal care routines, so any personal care routines, whether it be children and adults, you need to wear gloves and aprons. Disposing of bodily fluids, again, gloves and aprons. Laundry, so you're dealing with laundry, gloves and aprons. Cleaning, gloves and aprons, and dealing with any chemical waste, gloves and aprons. So that we call PPE, the personal protective equipment. So our final question, question number 17, is asking you to identify at least 4 examples of when personal protective equipment should be used. Use some of the examples from the slide before, but have a look, like I said, do some research and have a look for some of your own, but at least 4, no less. You can do more, but no less than 4. So now we've come to the end of the session, and you should know the main responsibilities of workers and employers for health and safety in health, social care, children and young people settings. You should have an understanding of the importance of assessing risk in relation to health and safety. Understand the importance of key areas of health and safety in relation to health, social care and children and young people settings, and know what contributes to the reduction of the spread of infection in health, social care and children and young people settings.